Good morning, good afternoon, and good evening to our participants, depending on where in the world you're joining us from today. My name is Patience Brown. I'm from the OECD Secretariat, and I'm the Principal Administrator of the Hazard Assessment and Pesticide Programs here at OECD. It is my pleasure to welcome you today to a webinar on integrated approaches to testing and assessment, concepts, and OECD case studies. I'm delighted to have with me today three panelists to discuss their experience with the OECD IATA Case Studies project and to give you perspectives from a variety of different stakeholders. But to start this particular webinar, I'd like to give just a short background introduction. Next slide, please. Next slide, please. Thank you very much. So to give you just a bit of information on the OECD IATA Case Studies project, the project was established under the OECD Working Party on Hazard Assessment in 2014, and it was intended to be a forum for exchanging scientific approaches and best practices. It was also intended to provide help to build confidence in new approach methods and innovative approaches in toxicology to be used in a regulatory context. We are now entering our 9th review cycle, and there have been more than 35 IATA case studies reviewed and published, and I'll talk about where you can find those. These are all integrated approaches to testing and assessment that are applied to a specific regulatory context. They use a variety of different approaches, and they address various endpoints. The whole intention of the project was to demonstrate flexible solutions for a variety of regulatory contexts. And if you're familiar with the OECD program on test guidelines, I want to make a big distinction between test guidelines, which are covered by mutual acceptance of data, meaning that all OECD member countries and adherent countries must accept the results from OECD test guidelines that are conducted in a GLP environment. IATAs are not covered by mutual acceptance of data. And this flexibility and sharing of approaches really removes some of the barriers to interdisciplinary approaches to sharing information. The flexibility is an inherent part of the project. Next slide, please. So just as a bit of background and understanding various acronyms and how they relate to one another, even people who are very immersed in this area don't always have the subtle distinctions between some of these terms. So I thought it would be helpful to orient this way. Integrated approaches to testing and assessment are really assessing information from a variety of different sources in order to come to a conclusion on the toxicology of a chemical or group of chemicals. If we think about this, this is really how risk assessment is done. It's not, no chemical risk assessment is made on information from a single source, but this integrated approaches to testing and assessment really defines some of the processes that are involved and really makes room for new approach methods in that process as well. Next slide, please. So this is a general workflow for IATAs. They all begin with a problem formulation or a regulatory context of use. One starts by gathering existing information, and this can include information on in vivo testing, in vitro testing, from the literature, from databases, as well as computational approaches such as QSARs. Those information sources are combined using a weight of evidence assessment, and this can really vary in terms of how the information is put together. And then there's an evaluation on whether or not there's enough information to make a regulatory conclusion. If yes, then one arrives at that conclusion, and if no, then additional information may be generated. And finally, the weight of evidence assessment is revisited until one can conclude. Next slide, please. So as you can see, there are multiple different strategies that might be used to gather information, and the weight of evidence assessment really involves expert judgment. This is intended to be flexible and suitable for the specific problem formulation. Next slide, please. I want to contrast the term IATA with adverse outcome pathways. So adverse outcome pathways are a series of biological events beginning with a molecular initiating event, followed by a series of key events and resulting in an adverse outcome. Next slide, please. This is just a generic version of an AOP or adverse outcome. You can see there are various key events that are linked by key event relationships. And these cover a range of levels of biological organizations, starting with molecular events and progressing through organs, organelles, to organisms or populations. Next slide, please. By definition, the types of information included in AOPs must be measurable. So just in a high-level overview, you can see here some of the types of testing or non-testing strategies you might use to interrogate these various levels of biological organization. Next slide, please. I see that there's a bit of delay between the slides that I'm seeing and what other people are seeing, so I'll try to slow down a little bit, so hopefully these will match. Next slide, please. When we think about the relationship between AOPs and IATAs, next slide. Really, the AOPs can be used to inform not only how information is gathered, but also how it's organized. And in fact, OECD has published a guidance document number 260, and it's hyperlinked here on how AOPs can help to inform IATA development. And you can see also in the webinar chat, a hyperlink to that same document. I'd like to emphasize that AOPs can be used in IATAs, but they are not a requirement. There are many different ways to build an IATA, and using an AOP framework is just one. Next slide, please. Next slide, please. So lastly, I want to make a distinction between IATAs and defined approaches. Defined approaches are a specific type of IATA that removes the expert judgment aspect. So it uses the same problem formulation and approach to gathering information, but in fact, the weight of evidence assessment is defined by what we call a data integration procedure, meaning that any two individuals running the same defined approach should come to the same conclusion. Next slide, please. And while IATAs are inherently flexible, as I mentioned, defined approaches are much more fixed or defined. They use defined information sources. As I mentioned, they used a fixed data interpretation procedure, and the regulatory conclusion is clear and reproducible among different users. So when we look at IATAs, we can think about defined approaches as one type of an IATA that's much more prescriptive and rules-based. And in fact, defined approaches are amenable to inclusion in OECD test guidelines, and they may be covered by the mutual acceptance of data. OECD now has two different defined approach test guidelines, one for skin sensitization and one for eye irritation. So this is really, we think of a continuum and a way to include these approaches in a harmonized way. Next slide, please. And the last acronym that we'll include is new approach methods. So there's really no agreed upon definition of new approach methods, but I will say that the OECD working definition is basically everything that's not an old approach method, if you will. So we try to be intentionally flexible and inclusive in the term new approach methods. This includes in chemico, in vitro approaches, as well as computational approaches, and in vivo methods that may be designed to bridge gaps or, for example, provide new sources of information like omics. The use of existing information is also included in new approach methods. So things like literature searches, chemical grouping approaches, and analog approaches are also covered under this working definition. And I should say that unlike some other organizations, the term that we use here at OECD is not exclusively non-animal methods, but it is aligned with the 3 R's principle to reduce animal use in toxicology testing, I should say. Next slide, please. So one very high level way of thinking about these is that both integrated approaches to testing and assessment and adverse outcome pathways are frameworks for organizing information. Next slide, please. And new approach methods are actually the methods you may use to generate information included in either of those frameworks, or perhaps both. Next slide, please. I'm very excited to open this webinar today that's really in part to highlight the new OECD IATA website that just was recently launched a few weeks ago. You can find out a lot more information by visiting the website. The QR code is provided here. I'd like to thank very much from the OECD Hannah Taubé for the hard work she's done to make it really very much more user-friendly. And I encourage you to take a look at the wealth of information, as well as some guidance on how to build your own IATA if you're interested in doing so. Next slide, please. In addition to resources, you can also find all of the IATA case studies that have been published to date. I know this is quite small print, but I encourage you to go find a larger version. And I know that other speakers today will touch upon this as well. There are a number of different case studies, as I mentioned. They vary by endpoint that they address, and they vary by approaches that they use, but there's really an exceptional amount of information provided here that's now publicly available after the peer review and internal processes at OECD. Next slide, please. There's a variety of expandable information in terms of what types of information might be included, how IATAs help to contribute to the reduction in animal use for chemical safety testing, IATAs and new approach methods, and AOPs, as I've already sort of gone through. Some advantages of using IATAs and standard ways of developing and reporting IATAs and their elements, including a variety of reporting standards that we use here at OECD to facilitate the review and sharing of information included in IATAs. Next slide, please. And then it's my pleasure to turn this webinar over to our three speakers today. Christy Sullivan from Physicians Committee for Responsible Medicine, Gavin Maxwell from Unilever, and Tara Barton-McLaren from Health Canada. I'd like to just point out that the speakers will run through their presentations, and then we will be followed by a panel session. So please do include your questions in the Q&A, not the chat if possible. It makes it much easier for us to manage. And if you have the question that's intended to be answered by a specific presenter, please indicate that, or we'll discuss as a group at the end. I also want to note that this webinar is being recorded, and the recorded presentations will be included in the new OECD IATA Case Studies, or sorry, IATA webinar, IATA website. There we go, IATA website, so you can revisit them later if you like. Thank you very much. And now it's my pleasure to introduce the first of our panel speakers, Dr. Gavin Maxwell. Dr. Maxwell is the Safety Science Advocacy Lead at Unilever, and he will be talking today about his experiences with the IATA Case Studies project over the last several years.
Thank you very much, Patience, and hello, everyone. Hopefully you can see my slides. As Patience said, I work within Unilever in a Safety and Environmental Assurance Centre. I've been working on this topic and for Unilever for the past 18 years. And it's my absolute privilege today to speak to you about the pivotal way in which the integrated approaches to testing and assessment are really moving the field forward. And I'll do that by using skin sensitization as an example. So before I go any further, though, I'm just going to explain a little bit more about what is Unilever as a company, what is our policy and approach in this space. So we believe in Unilever that animal testing is not needed to assess ingredient and product safety, and that it's possible to make safe and sustainable ingredients and products without animal testing. And we do that by applying a wide range of non-animal approaches. And we've been doing that for over 40 years, working in partnerships with over 70 collaborators. And we publish everything we do in this space. And it's a privilege to speak to you today. We cover a range of different products within our company. We've got home, personal care, foods and drink products. And therefore we cover a range of different exposures that are shown there at the bottom. And we need to safety assess both human health, environmental and occupational exposures in order to ensure our products are safe and sustainable. But what's been going on in the field? So I started at Unilever back in 2004, and it's been amazing to watch the change that's happened within this space in the last 15 or so years. As we increasingly move from just a traditional concept of risk assessment based on animal test data and extrapolation to predict safe exposures in human, to a next generation approach where we're taking non-animal exposure or bioavailability data and combining it with non-animal bioactivity data in order to define margins of safety that allow us to assess these chemical ingredients. And this change and this transition was really kicked off in 2007 by the work of the National Academies of Science in the US, and that Toxicity Testing in the 21st Century, a Vision and a Strategy report back in 2007 really initiated a series of pivotal publications from the US government authorities that have really pushed next generation risk assessment forward. And those ripples have gone globally now, and what we can see is there's now widespread use of these approaches, and we're all at different stages of applying these frameworks to chemical safety assessment. But what I'd like to do today is just share with you a perspective on how the OECD concepts and work have really helped move this transition forward. So I've got here the new approach methodologies, defined approach, and integrated approaches to testing and assessment that Patience just covered. And for me, these ladder up in a really logical fashion that allows people from all disciplines to engage with this transition and play their part in helping us build confidence, evaluate, and ultimately start to use next generation risk assessment approaches. But theory is always hard to get your head around. So what I'd like to do is talk you through the transition we've been on within the skin sensitization field over that period. And really talk you through the road to replacing skin sensitization that's been paved by these three concepts. So starting off with the adverse outcome pathway for skin sensitization. This was the first human health adverse outcome pathway that was published back in 2012. And it really brought together all the mechanistic research and thinking that had been ongoing within the field, trying to understand the different stages that were taking place in the induction of skin sensitization and how these could be broken down into different elements that could be turned into new approach methodologies, non-animal approaches, NAMs. So what we have here is the adverse outcome pathway. You can see running left to right. We start with chemical structure or properties. Then we have the molecular initiating event. Before we see the three key events there, sorry, 4 key events if you include the molecular initiating event, ultimately culminating in the adverse outcome, which is skin sensitization. So for covalent modification of protein and as an AOP, we start with a covalent binding of the chemical to skin proteins. There's then a mechanism through which either directly or indirectly you can see dendritic cell activation as key event 3. And in some cases, it's believed keratinocyte activation is pivotal for that as key event 2. Ultimately, it's the presentation of that modified skin protein to T cells that causes their activation and proliferation, initiating a new immune response to that modified protein. And it's the amplification and induction of that immune response that ultimately results in the adverse outcome. So what you can see hopefully in the layer below is there's a number of non-animal and in vivo methods that can be used to assess either different stages in this process or the adverse outcome, many of which supported by OECD test guidelines. So starting left, we've got the predictive chemistry approaches, the QSAR approaches, or the expert rule-based systems. We've got protein reactivity methods, keratinocyte activation assays, dendritic cell assays, T cell proliferation assays that are less widely used, and then adverse outcome where we have a number of animal tests, mouse local lymph node assay, guinea pig assays, and ultimately human evidence considered as if available in that space, but obviously not run as a test. So what you can see hopefully is we have a complexity of information here. Skin sensitization was never thought that it would be replaced as a one-to-one replacement. But the challenge was, how do we integrate this information in a more systematic way to make safety assessment decisions or estimate potency or allocate a GHS category? And ultimately, that's where the defined approach concept came in. So defined approach, as Patience said, is a fixed data interpretation procedure used to interpret a specific combination of information sources. So the key point there is fixed. So you're bringing in defined information sources and integrating them in a fixed way. And what that allows you to do is make a prediction, hopefully that's useful for regulatory decision making, but can be combined with other information such as exposure information as part of an IATA. Now, in 2014 and ultimately being published in 2016, there was a series of discussions where people were invited to submit their skin sensitization defined approaches as part of an OECD discussion in this space. And over 12 different defined approaches were reviewed, and that ultimately led to both reporting of those approaches, a template for doing so, but also a nice documented report there. So if you're interested, this is quite a long report, but it's a nice time capsule of how the thinking was at that time. And you can see the starting point for a lot of the approaches that are used today in that document. Now, these defined approaches were then evaluated, or at least a subset of them were, through a Cosmetics Europe project, which is the European Trade Association for the cosmetics industry, working with the US NICETM organization that supports ICVAM, the US Validation Authority. That's all published. The QR code for that analysis is on the screen. If you're interested in accessing the paper, obviously with QR codes, you just point your smartphone camera at the screen and then click on the link that appears through your camera app. What you can see is the figure 1 from that paper on the top right hand side, where Nicole and the team really were evaluating the different information sources that were used in each cases, with these little totem poles at the top there with the colour, and then how that overlapped in terms of coverage of the different chemical space. Now, ultimately, that exercise was shared with and formed a starting point for almost, I think, 4 years of discussions that took place at the OECD to evaluate a subset of the defined approaches that were submitted that culminated in this guideline that was published last year. And this was a great step forward in terms of replacement of skin sensitization, because this allowed for the first time sensitizer, non-sensitizer predictions to be made, but also predictions of GHS categories to be made in the absence of animal test data in a systematic, defined way. But then what was also going on in this space was a broader discussion, which was about how do you move from these predictions of hazard and of simple predictions of potency categories like the GHS categories to point of departure predictions that can be used in quantitative risk assessment. And a number of organizations were developing next generation risk assessment frameworks like the one I have on the screen here. So this one is actually a published example back from 2020, where a number of companies came together under Cosmetics Europe to look at, could they formulate a generic next generation risk assessment framework that covered the steps that were shared across those various frameworks. So what you have here is a tiered framework that's meant to be used in an exposure-based and a hypothesis-driven way, where you start on tier 0, identifying the use scenario for the chemical and any existing information. So box 1 there in the blue box, you can see you're considering applied dose, whether you're interested in a single exposure or an aggregate exposure. Moving on to box 2, you're considering the chemical structure and analysing the chemical of concern, thinking about the specifications, any impurities. Step 3 there, you're identifying existing information. So can you make in silico predictions based on the chemical structure or through searching databases? Is there any existing in vitro or in chemical data for either OECD Test Guideline or non-test guideline methods that could still be used as part of a weight of evidence? And you're also interested, of course, if there's any historical in vivo data, if this is not a novel chemical, before thinking about obviously analogues and applying read-across approaches. And it's worth noting it's possible if the exposure is very low and the chemicals of a particular type, that you could exit through an exposure-based away-in approach here. like the dermal threshold of concern concept. Then in tier 1, you're bringing all that information together to start to form a hypothesis based on weight of evidence about what you expect this chemical to be. It's possible at that point to conclude non-sensitizer, but if there's a potential that you are dealing with a sensitizing chemical, that's where you would move down to box 6, where you could generate additional information, or if you've already got enough information, move directly to box 7, where you would generate a point of departure prediction and estimate a potential potency metric for that ingredient. Before finally characterizing an uncertainty, maybe thinking about how your prediction relates to the consumer exposure being assessed and ultimately culminating in a risk assessment decision. So you can see here what we now have is quite a generic framework, but it allows you to integrate and pull together a range of different informations, combining the expertise of a number of different individuals and helping the risk assessor pull relevant information in and judging whether it's of sufficient quality in a structured manner. And if I advance to the next slide, what you can see is the team's next step was to take a case study and publish it through the OECD IATA Case Study project. And I know the team found this enormously rewarding. Submitting this case study allowed them to get a lot of peer review and feedback on what they'd considered. Was it appropriate? Were the decisions appropriate? And ultimately strengthened the approach through this level of discussion. But if you're interested in accessing this, it's number 368, a case study on the use of IATA for skin sensitization, demonstrating the next generation risk assessment framework using geraniol. And what they assessed here was a consumer exposure to the ingredient geraniol, looking at skin allergy risk and considering 0.1% use in a face cream product. And this allowed direct comparison of 5 different defined approaches of varying complexity, and ultimately was used not just in discussion with the OECD, but also with the SCCS and the EU, and shared as part of the European Partnership on Alternatives to Animal Testing, or EPAA. Now, there's a lot in this case study, and that's part of the richness of the IATA case study project. But for the purposes of this presentation, I'm just going to focus on the element that Unilever submitted, which is use of the Skin Allergy Risk Assessment Defined Approach, or SARA-DA. So just to talk you through this, again, this is how we frame our problem using the framework we use in HIVES. You can see all the elements are shared with that generic framework. And the way this problem was framed for use of geraniol was thinking about, let's assume this is a novel chemical, so we won't use any existing in vivo data, and we won't rely on read across or exposure-based wave-in, which in this case we couldn't do because we set the exposure too high to make a decision. We're going to rely solely on the NAM data and see how far can we get with this information. So this is published, again, the QR code's on the screen and the slides will be available afterwards. But what I'll do is I'll just talk you through the individual steps so you can start to understand how the NAMs are being brought together, how the defined approach features in this decision, and then ultimately how IATA as a concept provides an overarching structure for this assessment. So starting with collating existing information, in the top left-hand side there, you can see because we're doing a skin sensitization assessment for a specific product exposure, we're interested in characterizing dermal exposure. So the way we do that is we consider the percentage inclusion, and in this case, we're thinking about 0.02% of geraniol in a face cream. And that ultimately results in about 0.5 micrograms per centimeter squared local dermal exposure. We then also take the structure of geraniol and we pass it through a number of in silico approaches. So you can see there the alerts for direct nexus, times, ToxTree, and the OECD QSAR toolbox. And for those of you that enjoy using these tools and use them every day, what you can see quite quickly is we've got a range of alerts for potential metabolites, but not a lot happening with the parent molecule, geraniol. So this already starts to suggest that geraniol is activated to become a skin sensitizer through an auto-oxidation mechanism, and the confidence is actually quite high. You can see there's a good agreement across the tools there as well. So this would recommend that further targeting tested is useful. And what we would also do, in addition to the OECD test guideline methods, is use our in-house peptide reactivity profiling technique really to understand where we would expect adducts for this molecule to see if we can confirm this in silico assessment. So going on to that next data generation step, what you can see is we're spanning key event, well, the predictive chemistry we've covered, so we're spanning key event 1 through to 3 here, in terms of we've got assays that allow us to start to understand the peptide reactivity. So that's our reactivity profiling and direct peptide reactivity assay, or DPRA, where you can see there we've got levels of depletion, but they're quite low, and ultimately these wouldn't result in the DPRA in a positive classification for sensitizer potential. But in keratinogens, H-CLAT, and mucins, we're seeing a level of activation there that would correlate with a positive classification. So the targeted testing is again suggested the skin sensitization potential here, but again the peptide reactivity assays are suggesting potentially this is not a direct mechanism, and that again we would say this is supportive of a potential auto-oxidation mechanism. So then the way we integrate a subset of this information, namely the DPRA, keratinogens, H-CLAT, and mucins test data, would be through our skin allergy risk assessment, or SARA defined approach. Now this is a Bayesian probabilistic approach that estimates human sensitizer potency, and it can do that to predict a point of departure, but it also allows us to benchmark risk. So you can see there in the schematic in the top right, we're taking into account a range of different in vitro, in chemical, and not used in this case, but we can also take into account in vivo local lymph node assay or human data as well. And then we've also included a range of different consumer product relevant benchmarks to allow us to benchmark the level of risk against well-characterized scenarios. Now, we're actually involved in an ongoing collaboration with NICETM to expand the SARA database and adapt this defined approach to predict GHS categories in addition to a human point of departure. And that SARA ICE defined approach is currently under evaluation at the OECD DAS expert group. So for anyone who's involved in that discussion, that's a different DA to the one I'm about to share results from. So what does the output of the SARA DA look like? Well, it's this panel here on the right-hand side. So you can see here the different predictions of human potency, this ED01 metric, which is a predicted 1% sensitizing dose in a human repeat insult patch test. You can see the prediction is the dot in the center, but you've got uncertainty either side of the prediction, with the 50% and 95 percentile regions in the bold and faint lines there either side of the prediction. And the way we've displayed this, so geraniums, they are highlighted in the green about the center of that plot. But what we've also done, and we find this really helpful, is to include the other chemicals that are in the database as well. And this allows us to place this new chemical in a continuum based on our experience. And you can see here, we're predicting for geraniol, the expected ED0 is 4,500 micrograms per centimeter squared. So that's the point of departure, or the level where we would expect to see 1% of an HRIPT population potentially sensitized. And this ranks alongside a molecule like eugenol, which if you take the local lymph node assay data would be reported to have, say, a moderate skin sensitizer potency. So we've confirmed again, not just that this has got potency, but also we've been able to come out with a quantitative point of departure prediction. So we can then take that and apply that to a second part of the SARA-DA, which allows us to benchmark it against a range of different risk metrics. So we're taking that 0.02% geraniol in a face cream, and we're applying that along with the ED01 information against these risk benchmarks. And you can see at the top there, we've got benchmarks that are seen as high risk, and at the bottom there are things that are low risk based on published experience. And what we find is that not just this exposure ranks as low risk, but also that it's got a 95% probability as being low risk. Now, so for us at this point, we would conclude it would be okay to market this ingredient in that product at that level. And just to break the fourth wall a little bit at the moment, if we say, okay, this isn't a novel ingredient, and we look at the in vivo data, either alone or in combination with the NAM data, that prediction doesn't change. You see changes in the ED01, but ultimately it still remains low risk. And it's through case studies like this, we increasingly build our confidence, not just that these approaches are useful, but they're also protective. So I'd also like to just take this opportunity to promote the OECD IATA project website. It is becoming the repository of case studies exploring use of NAMs, our chemical safety assessment, and the breadth and depth of the analysis that is captured here already is really captivating. So I'm sure over the next few weeks you may have some spare time. So what better time to browse the database and really start to look and see if there's case studies that are relevant for problems you may be working on. So how would I like to conclude this talk? Well, for me, there's clearly a paradigm shift underway as we move from traditional to next generation risk assessment approaches for chemical safety assessment. These are increasingly becoming widespread, and we need to find ways of ensuring this transition is supported through looking for ways to increase the scientific dialogue around these case studies, continue to build collaboration, particularly between industry and regulatory end users of these approaches, so that we can build consensus on what a responsible use and transition looks like. And increasingly, we need to bring people into this field who haven't had the time to acquaint themselves with it through education and training activities. Now, for me, the OECD IATA activities are really helping drive this transition through promoting global knowledge exchange and really working to harmonize best practice. The laddering up of the AOP, NAMs, defined approach and IATA concepts really helps structure, standardize, and communicate experience in this space in a way that every discipline involved in this transition can hopefully understand and interact with. And we need to work hard at this. I've shared skin sensitization today. My fellow speakers will share other examples, but these case studies are mounting, and increasingly the debate is how do we generalize from them to start to evolve our chemical safety assessment frameworks and really develop guidance that will help people use these approaches in a standardized, reviewable way. So with that, I would just like to acknowledge my CIAT colleagues and our collaborators and share that all of our work is published on the TT21C website, and say thank you very much to the OECD for the opportunity to share our experience today, and good luck with the rollout of the Case Study Project website.
Thank you so much for an excellent presentation, Gavin. That was lovely. And thank you for all of the promotion of the OECD activities as well.
Thank you.
Love that. So you heard as our first speaker, some lovely connections between the important role of the IATA Case Studies project and the uptake of some of the new approach methods and next generation risk assessments and chemical safety assessments. You also heard about how the experience gained in the IATA case studies has led to some of the most innovative OECD test guidelines that are out there using defined approaches, and now the SARA model will be included in a future OECD test guideline. So really this is where the interface works between sort of theoretical ways of assessing chemicals and how we're doing it as standard practice. I will remind you all to please include your questions for Gavin or any of the other panelists in the Q&A. I see there are a number coming in, so we look forward to addressing those when the presentations are done in a panel format. And with that, it's my pleasure to introduce our next presenter, Christy Sullivan, who's the Vice President for Research Policy at the Physicians Committee for Responsible Medicine. Christy, the floor is yours.
There we go. Sorry, I lost my microphone there for a minute. Okay, well, hopefully you can see my slides well. And thank you very much for the invitation to speak today. Just cover that up there. Okay. Well, I think Gavin gave a nice introduction, and I'm going to continue to explore some of the concepts that he presented to you through the IATA Case Studies project, and probably give you a little more of a shout out to the new website. So we'll get started. In case you're not familiar with my organization, the Physicians Committee is a DC-based NGO. We were founded in 1985, and our staff includes scientists, physicians, clinical researchers, dietitians, and of course, toxicologists. Our aim in that regard is to modernize toxicology to be more human relevant and use fewer animals. And we do this by working with regulatory agencies, industry, the OECD, other relevant stakeholders, for example, to publish peer-reviewed literature, to provide funding for new approach methods and advice to agencies and companies. We hold collaborative workshops and training and capacity building on these new approaches, and we do congressional and agency lobbying in North America mostly. And along with 10 other organizations around the world, we are part of something called the International Council for Animal Protection in OECD programs, or ICAPO, which has been engaging with member countries and stakeholders to advance chemical assessment methodologies since 2005. There we go. So I think when you ask anyone in the toxicology field right now, especially those interested in implementing more new approach methodologies or NAMs about gaps or needs, you almost always hear that we need more case studies. And I happen to agree with this, and I'm guessing you do too, since you're here today, but why are case studies so sought after? And why is the OECD IATA Case Studies project so important? I think when the National Academy's Toxicity Testing in the 21st Century report came out, which Gavin referred to, the authors were really asking us to envision a completely different way to assess chemicals in the process we currently use. And many of us have learned in our studies and our careers. And as the title implied, they give us a vision, right, for what this new system could look like. But I recall a lot of questions and even some skepticism at conferences for several years afterwards, with people trying to square, the current risk assessment processes with information about toxicity pathways and modeling outputs and weight of evidence. And so, how does all this information from many different kinds of tests get put together? What about chronic or multi-dose endpoints? What about the endocrine system or other systems that are dependent on each other? we're essentially being asked to look into a crystal ball, to imagine something new while continuing to follow the traditional approach. So over the years, more and more of this picture has been filled in with tools and projects like the US EPA ToxCast program, the AOP framework, and of course, some of the case study efforts underway, programs like SURAD and APCRA. I think case studies really help us clarify this crystal ball. They help us see, rather than have to envision how to put together a variety of approaches and to use that information coming from those methods to make a decision. They help us see what it looks like to make decisions with non-animal approaches. And importantly, what our peers are doing to gain enough comfort and confidence to adopt something new. So this is, I think, why the case studies in general are so important, and why the OECD IATA Case Studies project in particular can be so impactful. As Gavin said, it's really the ultimate source for NAM's case studies for regulatory chemical safety assessment. So I want to give you a little bit more information about what is available in the library. We've been involved in supporting the development of case studies projects since the beginning, and so I'm excited to see how much it's grown over the years. One neat thing to know is that the case studies currently available are pretty diverse. You have lots of different kinds of endpoints covered in the different case studies, from neurotoxicity to developmental neurotoxicity, mutagenicity, endocrine disruption. So a lot there, depending on no matter what your interest. And there are also a number of different kinds of application contexts. So this is a screenshot from the interactive portion of the website, and you can see at the top here, the case studies are kind of marked depending on whether they include different kinds of concepts like uncertainty, low or no toxicity prediction. And you can also filter depending on what kinds of endpoints you're interested in, or contexts of use. And I wanted to also give you a sense of the kinds of case studies that have been developed every year. And this is just a sample of some of the notable ones, but there are others each year that, that are described. So in the early days, there was quite a bit of read across, and for specific endpoints like hepatotoxicity of allyl esters, using an IATA for repeat dose toxicity, read across for phenolic benzotriazoles. But then we start to bring in some other approaches. There was a cumulative risk assessment and life stage susceptibility case study, estrogenicity of phenols, a nanomaterials case study. And then in 2018, we have a case study on integrated approaches to testing and assessment for estrogen receptor active chemicals, which uses a set of in vitro and modeling approaches. So every year there are new case studies being worked through, evaluated, and published. You can see in 19 and 2020, there were some nice neurotoxicity and developmental neurotoxicity. And then in particular in 2021, there was a whole set of 5 studies with developmental neurotoxicity. So many of these case studies are working through common questions that arise, like characterization and reporting of uncertainty, combining data in weight of evidence, use of IVIVE modeling, improvement of read across and category formation, cumulative exposures, how people think through and demonstrate the technical validity of different approaches. So if you're looking for deliberation of different considerations, also note that each year there was a document published called a considerations document that summarizes some of the particular challenges that were addressed and in each of the case studies that year. So hopefully you see this website as a resource that you can come to either as a regulator or an industry evaluator or even a test method developer to understand, you know, how the cases are worked through and the particular issues that are addressed. So I was part of a team that published a case study in 2021 cycle in partnership with Syngenta and Roper Toxicology and EPA. And you can find it on the case studies website or in the list of publications on the series on testing and assessment, number 367. And this case study, it's an IATA for refining inhalation risk assessment for a pesticide, chlorothalonil. And it basically describes a source to outcome approach for assessing this inhalation risk. The general strategy was to look at sort of the particle size distribution of inhalable particles to assess the external inhalation exposure, and then to assess the internal inhalation exposure with computational fluid dynamic modeling, and combined with the toxicity of the inhaled chemical using in vitro testing, putting that together to derive a benchmark dose calculation and a risk assessment in place of a 90-day rat inhalation study. So this approach was designed during sort of a regular registration review process through US EPA, which data needs were identified for inhalation toxicity for chlorothalonil. So for the computational fluid dynamic modeling of the human respiratory system was used to try to understand the potential deposition of the chlorothalonil aerosol. And it was found that about 99% of the pesticide would likely be deposited in the upper respiratory system, with very small amounts in the remainder of the respiratory system. So for the toxicity studies, a 3-dimensional upper airway model was used, the mucil air model, which is produced by Epithelix, to assess 3 different membrane and cell damage endpoints as markers of irritation, including on the screen here, you can see the transepithelial electrical resistance, or TEER, lactate dehydrogenase, and rosazurin metabolism. And these endpoints were chosen and are sort of reflective of evidence that the chlorothalonil acts on the respiratory system via contact irritation. So while there isn't sort of a fully endorsed AOP, and an AOP understanding of the chemical's mode of action was integrated into the case study to provide some biological relevance to the choice of the model and the endpoints. And then the data for the case study was generated using primary human airway cells from 14 pooled donors. And as part of the study to gain confidence, they investigated a number of exposure scenarios, including we have a single 8-hour treatment, a 24-hour treatment, and then a repeated dose treatment for 5 days. So I'm not going to delve deeply into the data, and I'll give you some links to show you where you can do that. But essentially, the data is consistent with tissue irritation mode of action hypothesis, with dose-dependent effect on 2 of the 3 endpoints, TEER and rosazurin metabolism. And then benchmark dose modeling was conducted to apply the data. The 24-hour exposure essentially was used to provide a more conservative approach than the 8-hour exposure. And then one other thing to note, and this is discussed more in the case study, is that repeated exposures did not substantially affect the data or the eventual benchmark dose. And this is consistent. You would expect this, right? With looking at an upstream endpoint, you would expect effects early and at low doses. So as I said, I'm not diving into the fine details of the case study today, but there's a lot out there that you can find if you want more details. Of course, there's the case study itself, but there's also been some presentations and webinars given over the years by some of the scientists working in this case study, Marie Hargrove and Doug Wolf from Syngenta, Monique Perron from EPA, Clive Roper from Roper Toxicology, and you can follow those links on the QR codes to find some recordings for those presentations. And in terms of the science behind the case study, there are quite a few publications referenced as well in the case study. So finally, I want to talk a little bit more about how this case study is a good example of how the IATA Case Studies program at OECD can help us to gain confidence in new approaches. And Gavin and patients have been mentioning this as well. So just a little bit about the case study, how the case study process works. First, there are templates and guiding questions that are available to the authors to help pull out information that allows for consistent presentation and review by the regulatory commenters in the project group. Authors are asked to provide the purpose or the context of use for the IATA and how they think it could be applied. And then throughout the process, which takes several months, there is an opportunity for a presentation, and then there's a written commenting period on the case study document and a revision, and then an in-person discussion. So there's really a lot of opportunity for learning and discussion. After the case studies have been deliberated, a considerations document is added to with, as I mentioned, learnings from each case study. So essentially building a library that future authors can refer to. And then there are also a nice feature, which is that sometimes there are tools webinars where you can have a specific presentation to delve deeper into some of the methodologies within case studies. So for the chlorothalonil case study, we received quite a few helpful comments, and there are always helpful and nice discussions, but I think possibly for this case, it was perhaps one of the first times an in vitro three-dimensional model of respiratory tissue was being put forward in this arena. So there were lots of questions about the various methodological and scientific choices made during the study. So after the commenting period, we created a new section that walks through some of the choices that were made during this study. Either considerations that you might be facing should you try to follow this approach, or a similar approach for different chemicals. So it goes through and just provides some very high level remarks about the choice of the three-dimensional model, the choice of the computational fluid dynamic model. You might make different choices in terms of your endpoints if you have a different kind of AOP or you don't have an AOP. Things like your study design, your test article, what form it's in, the number of replicates or donors, the type of exposure system, whether that's a liquid pipette or it's a nebulized aerosol. There was some discussion about, especially for the computational fluid dynamic part, about whether you would vary that model to take into account different breathing rates or breathing patterns for people who are having physical activity, or for children, for example. So these are all kind of the things that you might want to think about if you're following this approach. And then, of course, this is really specific to EPA's regulatory application. And so other organizations, other agencies might make different choices in terms of interpretation of the data. And I think this all fits really nicely with a recent framework for building confidence in new approach methods that was recently published by Anna van der Zalm et al. So the framework kind of establishes different groups of considerations or different concepts that you want to keep in mind in order to build confidence, including course fitness for purpose, biological relevance, technical characterization, that's kind of what are the details of the methods and does it perform well, concepts such as the need for independent review and data transparency. And I think that case studies, especially following the approach that OECD is taking, can help provide information, of course, about a NAM's fitness for specific purposes, and also biological relevance that's kind of baked into the template. It could also provide some information about technical characterization of the approach or methods that make up the approach, depending on the data that's available. And just briefly digging deeper into fitness for purpose, these, use my pointer here. Of course, there are different aspects of fitness for purpose. We have which regulatory statutes are relevant here. You should be able to address technical performance, including level of uncertainty. How will the NAM be used? So in this case, in the IATA case study, that provides obviously some information there. What is the context of use? What is it envisioned to be used for? So the case study I described, for example, was an EPA context of use. Different decisions, as I said, might have been made if another regulatory agency was confronted with this data. And I think that's the power of the OECD process, is you can talk through some of these questions directly with folks around the table and have the discussions to say, okay, well, this is my context of use. What about your regulatory context? What about your regulatory statutes? Will this work for your purposes, or are there different pieces of information you need to know, or are there different considerations that we need to have? So I think then the case study can be a launching pad for additional technical characterization of the approach. And you would envision strategically developing additional data to expand, from the sort of original case study, expand the applicable chemical space or the product sector, maybe add a new decision context or test if the approach is applicable to additional mechanisms of action. So in this way, you can envision a process of evaluating and validating different approaches by gaining experience with expanding application. And I would suggest that maybe one interesting approach we could consider in this context is going back and updating some of the previous case studies, either with additional data that has been generated or developing new data to kind of make a more widely applicable guidance, as Kevin was mentioning. So in summary, I hope you've gotten the message that IATA case studies are really essential to envisioning 21st century toxicology, that they provide a venue and process for continually learning by case study authors and regulatory commentators, especially within the OECD context, that the OECD IATA site is a nice resource for flagship case studies, and that we can continue to gain additional value from these case studies by expanding them to grow our confidence. So I just want to thank you for your attention, encourage you to get in touch or to follow me if you are interested, and also to acknowledge my case study collaborators here, and thanks to OECD for the invitation.
Thank you, Christy. That was great. It was really, really exciting to see the summary of the work that y'all have done and presented to the group, of course. I think it was a really nice example of a way you can build a case study without perhaps having a fully vetted AOP, and where there are not fantastic animal test methods that are available. But also, I really liked the follow along activity that the IATA itself on respiratory toxicology, or toxicity rather, sort of started preliminary guidance for potential other users of a similar approach or other considerations in different regulatory contexts. I think that is really one of the ideals, if you will, of the project itself. Just to pick up a couple of things you mentioned, I'd like to point out the considerations document that is really intended to be a review of all of the IATA case studies in a particular review cycle and all of the review cycles to date. It's really about the totality of information. We updated that in 2022 as well to hopefully be a lot more user-friendly. It's also linked on the website. And as Christy pointed out, the interactive part of the website has now functionality to be searchable by keyword. So I encourage you all to visit that. Thanks so much. So again, just a reminder to all of you who have questions for Christy or for any of the panelists to please include your questions in the Q&A. I do see questions coming in. We look forward to the panelist discussion where we'll address some of those. But certainly before we get to that, we have our third and final presentation of this webinar series. It is my pleasure to introduce Tara Barton-McLaren. She is the Research Manager in the Emerging Approaches Unit on Healthy Environments and Consumer Safety at Health Canada. Tara, the floor is yours.
Okay, great. Now I will share my screen to get us started. Okay, so I trust that everybody is seeing the correct screen. So thank you very much for the invitation to join this webinar with great speakers and to share some of our experiences and I guess reflections that we have over the development of case studies within the OECD IATA Case Studies project for the last number of years. I certainly echo what's been shared in terms of the tremendous value in participating in the development and review of these case studies, and really thank the first speakers for introducing so nicely many of the practical concepts and considerations which will kind of follow through what I'm going to share with you today. So quickly, just kind of positioning where we are in Canada in terms of the chemicals management plan. So we've been working through the 3 phases of the chemicals management plan since 2006, working to complete the 3rd phase most recently, and then using our experiences and lessons learned to look forward in terms of future program priorities through the modernization of the Canadian Environmental Protection Act. So what I'm going to kind of speak to are the experiences that we've had in the development and application of new approach methods through the 3 phases of the CMP. And so there's been really an ongoing evolution in the development of fit for purpose approaches throughout the 3 phases of the CMP, starting most significantly in phase 2, where we really began to introduce the expanded use of alternative approaches, particularly in silico and read across, to address groups of substances. And then as we worked through the 3rd phase, we really recognized that many of the remaining priorities have a range of data availability, many with very limited data. And this provided us with the opportunity to really begin to explore and integrate alternative approaches, but it also highlighted the need for innovation and to continue to use and modernize different approaches within our risk assessment activities. So, consistent with the global efforts, we are looking to move towards integrating NAM for chemicals management in Canada. But I'm sure many of you can agree that transitioning to NAM as a complete replacement of animals will likely be a challenging and slow process. So we've started to kind of think about what might be kind of a near-term realistic starting point. And so we've been looking for these immediate or near-term opportunities to begin to deploy currently available NAM with respect to prioritization and risk assessment activities, and really looking to see how these new approach methods can help focus the burden of assessing chemicals in Canada. So for example, looking through prioritization processes to identify those that may have the greatest potential for risk to look at, in further activities. So we've really been focusing early development and application of NAM where the opportunities present in terms of NAM being a step above status quo, for example, and where the development of fit for purpose NAM-based approaches can help inform better decisions in the absence of other traditional forms of toxicity testing. So specific examples really include being able to better address data poor substances, add further mechanistic or mode of action information. We've been looking into different computational tools, machine learning, in order to develop data integration approaches, as well as to better identify and be able to address areas of emerging concern. And so we've been exploring, as I mentioned, these computational and novel testing strategies across various levels of biological organization. And so looking across the adverse outcome pathway, we've been focusing on developing techniques in silico and in chemical space, in the in vitro space, focusing largely on high throughput and high contact cell-based assays, but also recognizing that the need to convert these in vitro concentrations to human relevant doses is really critical so that we can compare these metrics to human exposure estimates. Many of these efforts have been ongoing as very important research and regulatory collaborations in the form of case studies. And really what we're looking to do is to develop interpretation and application approaches so that we can better understand how the emerging information or these new types of data can be used in various regulatory contexts. So we've had some very critical efforts and partnerships that have created specific milestones on the path towards applying IATA and NAM under Canada's CMP. We have an external advisory committee, or our CMP Science Committee, where we had many discussions looking for considerations for integrating NAM within the CMP. And so that committee ran from 2014 to 2020. We also have various completed and ongoing case studies under the Accelerating the Pace of Chemical Risk Assessment initiative, which is the government to government initiative, really again focused on developing case studies to specifically address the challenges to implementation of new approach methodologies and risk assessment decision-making. And then very importantly, and the focus of today, is really the ongoing contributions and efforts and learnings from participation in the OECD IATA Case Studies project. So as Christy mentioned, we had 2 early case studies, which we submitted in 2015. And then what I'm going to speak to a little bit further is case study 3 and 4, which were published respectively in 2019 and just very recently. So some of the motivation for moving kind of beyond case study 1 and 2, which really focused on read across and focusing more on how we may work to the integration and use of new approach methods within the IATA, was some of the discussions that had been had with our CMP Science Committee. In 2018, the committee deliberated on considerations for the future of risk assessment in the context of endocrine disrupting chemicals. And from these deliberations, a framework was proposed with specific considerations to enhance current practices to better use NAM data in this context. So what you see here is a figure that was proposed by the Science Committee, which outlines a conceptual strategy, illustrating a series of steps, so really working from left to right, that could be taken in a tiered manner, integrating various types of NAMs to better address EDCs under the CMP, both in the context of priority setting, as well as more in-depth risk assessment. Within this, there's also suggestions or questions in these yellow boxes below, which pertain to each step that require further exploration or development in order to expand upon this strategy. So we took this thinking into consideration and really wondered how we could develop a case study to demonstrate how we may work to realize such a strategy looking forward under the CMP. And so case study 3 was the first case study that we developed, and it was focused on predicting estrogen receptor activation for a group of substituted phenols. Again, like others, I've included these QR codes so that you can easily access these publications. And without going into great depth, what was done here was that we developed a workflow that integrates read across. And so we explored different ways of analog identification, then integrated read across, QSAR predictions, and in vitro data, coupled with in vitro to in vivo extrapolation to prioritize chemicals based on the potential to interact with the estrogen receptor. The workflow really relies on existing ToxCast data in the 16 ER pathway related assays that are required to calculate the area under the curve score, or AUC score. Now, we found this case study demonstrated to be very useful for prioritizing chemicals that have already been tested under ToxCast. But when we started looking prospectively, there was a significant proportion of chemicals on our domestic substance list that we may be interested in that lack ToxCast data and also lack the toxicokinetics data. And so we wanted to look across different technologies that may enable us to expand on the chemical space for which we could apply such IATA. So this led us to think about our fourth case study. This fourth case study is focused on a broader group of bisphenols, which are of regulatory interest in Canada. And we built on our work and learnings from the substituted phenols case study. We specifically expanded the approach to include additional in vitro information beyond what was available in ToxCast and focused specifically on in vitro transcriptomics. Now, this is an area at Health Canada that is of interest and for which we have significant expertise within the program for both data generation and analysis. The other, interest in using the in vitro transcriptomics approach is that there's an established gene set biomarker that offers ability to examine ER activity. Transcriptomics is high content, and so using this approach, it allows us to explore potential toxicities beyond ER pathway, and so that we can look at other, potential toxicities simultaneously within the same experiment. And then we were able to design our own experiment to really think about addressing the specific questions or specific needs or specific data gaps that we had identified. And so beyond interest and expertise, obviously within Health Canada, there is significant expertise in this area internationally, and it is an area of interest and work under the OECD. So if you haven't yet, again, I would urge you to take a look at the Omics Technologies and Chemical Testing website under the OECD, where a number of the advantages of applying omics are listed, as well as ongoing and future project areas. But what we wanted to do within this case study was really to gain experience in deriving in vitro points of departure using a different technology than the high throughput screening. And so we were looking to develop a quantitative risk-based approach to identify potentially hazardous substances. We wanted to use benchmark concentration modeling and work to determine optimal methods to derive transcriptomic points of departure. Again, considering the high throughput bioactivity data with the high throughput toxicokinetic modeling. And through this case study, we wanted to begin at least to work towards addressing some of the key challenges that we hear are quite common in terms of transparency, data or standardization, and working towards defining at least acceptable, if not getting to best practices. So this led us to this case study where we were exploring specifically transcriptomics and biomarker signatures to support molecular-based points of departure and the identification of endocrine modes of action. And I'm very excited to say that hot off the press, this case study was published yesterday, and so it's now publicly available to everybody. And I wanted to, at this time, take the opportunity to really thank the team and the significant contributions of both our regulatory and research scientists at Health Canada, as well as Dr. Carol Yock at the University of Ottawa and Dr. Chris Corton at the US EPA for the biomarker work. So it was a great team that had many contributions over a couple of years to this case study. So specific case study objectives were threefold. The first, we wanted to determine a minimal concentration corresponding to a bioactivity threshold observed using targeted in vitro assays. Second, we wanted to combine these thresholds with in vitro to in vivo extrapolation, IVIVE models, in order to estimate surrogate NAM-based points of departure for two different types. First, a hazard independent, so we're calling this the general systemic toxicity. And the second is for pathway specific, and this is where we looked at the ER alpha biomarkers, so more predictive of ER mediated effects. And third, we wanted to demonstrate that molecular-based points of departure do in fact serve as a lower bound or a protective estimate of effect levels that may be observed in vivo or in traditional animal studies. Now, when we're working with an in vitro model, there are various considerations and some not all that simple to get us from the data generation and collection to the application. So that being right from the onset, thinking to the development of a design of the study that best describes or best addresses the potential hazards or the questions of concern. There are many considerations in terms of processing and converting raw values into usable endpoints. At the analysis and interpretation stage, there's really the need to work through and decide what the optimal means of determining the molecular point of departure minimal bioactivity concentration is. And then importantly, to be able to apply these metrics, we need to convert the endpoints from the in vitro data into human relevant values that can be compared to exposure estimates. And so for the application then, we need to think about how within our regulatory frameworks and within different contexts of use, could we apply these in vitro based points of departure. So to look and work through some of these questions, this is kind of a high level overview of the methodology and workflow. We first collected data from various sources. So specifically, we collected high throughput in vitro data from the ToxCast program, so AC50 values. We generated and collected various QSAR and in silico predictions. And then we generated in-house at Health Canada and in collaboration with Carol Yock at AutoEU, the in vitro high throughput transcriptomics data. And so to do so, we used the human MCF7 cells as a model. We generated data for 25 target chemicals, 18 of which had the bisphenol substructure, 7 of which were identified as having a potential use as a functional alternative to BPA. And then the second step was to derive the estimates. So this is the point of departure estimate derivation for the 2 different pathways, the systemic toxicity and ER specific. And then step 3 was the IV-IVE modeling. And I'll go into step 2 and step 3 in a little bit more detail now. So specific to the high throughput screening, again, the methodologies used were those that were already published and developed through the APCRA case study, which considered the high throughput in vitro bioactivity together with the high throughput toxicokinetic modeling to derive the in vitro points of departure using the ToxCast data. And so following this, we used the 5th percentile from the distribution of AC50 values and also used the prediction of the ER activation with the integrated concentration response curve. So these are the 16 ER specific assays to derive the area under the curve score. We then ran various models, collected and interpreted the predictions. So we looked at in vitro ER activity data from the EPA CRAP project. We also collected predictions using the OECD QSAR toolbox and ADMET predictor, as well as developed some Health Canada random forest models. These models were developed in order to kind of broaden the chemical space for which we could predict ER and AR activity. And so looking at this, it is a busy table, but really I just want to kind of give you the overall in silico results. Looking at this, we can quickly see that these results strongly suggest that substances have endocrine disrupting properties. So the chemicals are listed down the left-hand side. And specifically in the blue, demonstrates the capacity to interact with estrogen receptors as ER binders. We can also see that there's a strong trend in terms of agonistic activity. And in terms of antagonistic potential, we see some potential here, but this is where the predictions seem to show the most discrepancy. I don't think this is really unexpected given the different type of data set that we're working with to generate these models, and that the models were trained independently. But overall, you can see that the various chemicals that we looked at in terms of the in silico predictions really strongly suggest endocrine disrupting properties or activities. We then went on to collect various types of in vivo data where available. So we looked through widely available public databases such as EPA's ToxVal DB, the ECHA-REACH dossiers, NICETA Mutotrophic database, etc. And after collecting all of the information, we still found that, considering this in the overall weight of evidence and putting together the various lines of data that we had, that for many of the bisphenols that we were interested in, there was still insufficient information to really support a regulatory conclusion. And so this is really the importance of the opportunity to generate data to fill these data gaps and the purpose of the generation of the high throughput transcriptomics data. So incorporating transcriptomics in regulatory decision making is not all that easy. And with this significant collaboration, we're working through some of these considerations. But essentially, for each transcriptomics experiment, there's thousands of genes per chemical and each exposure. All of that information then needs to be thought about in order to extract predictive signatures and pathways. And this includes applying specific parameters to identify the genes with a concentration response. It includes the use of mathematical models to identify defined response above background in terms of the dose response modeling, and using all of these approaches then to establish points of departure that could be used for assessment activities. And so there are no current consensus on the best approaches for using benchmark concentration models to derive a point of departure. And so what we really wanted to do with this case study is to kind of dig into this and see if we could make some step forwards in being able to propose, at least some acceptable approaches moving forward. So to do this, we built on methods that were previously published by our group in collaboration with others, looking at high throughput transcriptomics as a platform for relative potency characterization. And so building upon that, we looked at actually 4 different approaches to derive general systemic toxicity points of departure, that being the 5th percentile, the 10th percentile, our first mode, the 25th ranked gene, and the lowest median gene set. And this is the NTP approach. We also looked at 2 different approaches to derive pathway-specific NAM-based points of departure, the 5th percentile of target genes of upstream regulators, as well as ER alpha-specific biomarkers. And I'm only going to show you some of the results from the ER alpha-specific biomarker. But without going into the details of the methods used here, you can find them briefly described in the recent IATA publication. And very soon to be available is Matteo et al. And this is in Toxicological Sciences. It's a recent paper that's been accepted that really goes into more of the specifics related to the methods that were used here. So what did we find? So first, this is looking at the comparison of in vitro minimal bioactivity concentration that were derived for the general systemic toxicity across the multiple approaches that we used. And what you can see here is that there is general agreement across approaches falling within an order of magnitude for a majority of the chemicals that we looked at. However, there were some exceptions noted, and these exceptions largely fall kind of on this left-hand side of the figure here. And what we see related to these exceptions is that this was occurring when there were fewer total genes with benchmark concentrations. And so we thought that it is possible that for these chemicals that had the fewer genes with BMCs, that we could be introducing a bias that manifests as a very sensitive BMC, and that may not actually be an accurate representation of the minimal bioactivity concentration. What you can see with some of these chemicals here as well is that we were not able to actually generate a 25th ranked gene. So for these chemicals, when I say fewer total genes, there's less than 25. So we next wanted to see how the outcomes of this analysis compared with other in vitro data, so specifically the ToxCast data. And so when we compare these specific approaches with the minimal bioactivity concentrations derived using the ToxCast data and the approach described, we can see here that some of the specific approaches really demonstrate the potential to be quite robust for the derivation of molecular-based points of departure. And most specifically, we focused on the 25th ranked gene again. So this was observed to have the closest agreement with the toxicast values, and really demonstrated to be more stable and less influenced by the inclusion or exclusion of the top concentrations relative to the 5th percentile BMC. So it was this 25th ranked gene approach that we brought forward into the next part of the analysis. So the next part of the analysis, which will also soon be available in the Toxicological Sciences manuscript, was comparing the outcomes of the ER alpha biomarker and the gene set bioactivity derived from the whole transcriptome analysis. In this figure, the 25th ranked gene approach is brought forward. It's shown in the, I guess, yellow or beige squares. The results from the ER alpha biomarker approach is in the pink circles, and the lowest medium pathway is in the purple triangles. So what is shown here is that we can see 9 of the chemicals evaluated were predicted to be ER alpha agonists. 3 of the BP alternative chemicals had fewer than 25 genes fitting the BMC models, so consistent with what I just showed you in a couple of slides back. And so we determined these to be not transcriptionally active based on this evaluation. Again, this is the bottom of the chemical list on the y-axis. And then in terms of potency, the chemicals are ranked from the highest potency at the top to the lowest potency at the bottom based on the 25th gene BMC. And so you can see this approach both has been useful in identifying ER alpha agonist, as well as rank the potency, the general potency based on the systemic toxicity. But what I want to highlight here is that this is based on the benchmark concentrations, the in vitro concentrations. So now to be able to apply this more effectively in a risk assessment context, we need to move into step 3, which is really the extrapolation of the in vitro concentrations into applied equivalent dose, which can be compared to exposure estimates. So we followed the methodology that was published in our science approach document in 2021. And so although this science approach document focused on the methodology for the AC50 values from the toxicast endpoints, the same can be applied to the benchmark concentrations from the transcriptomics data. So we used these BMCs and converted them to their respective applied equivalent dose or AED values through the use of HTTK modeling and IVIVE. And so after basically looking at or applying plasma protein binding and hepatic clearance data to parameterize a generic pharmacokinetic model, then this model was used to estimate steady state plasma concentrations at a given administered dose under the assumption of 100% bioavailability. The distribution then of these steady state plasma concentrations were modeled using Monte Carlo simulation. And then assuming a linear relation reverse dosimetry can then be used to estimate the oral dose required to reach that steady state plasma concentration equal to the BMC or the AC50. And then these AEDs represent the derived NAM-based or bioactivity point of departure that can be compared to the traditional point of departure collected from animal studies. It can also be compared to the exposure estimates, Canadian population or otherwise, if we wanted to establish a risk metric. So after we've done all of this conversion, what does the evidence integration look like for the actual application of the IATA? So this figure shows how all of kind of the lines of evidence come together to inform potency as well as prioritization of some of the chemicals from this group. So again, on the y-axis, this is the chemicals listed, and those that are highlighted in red are considered active based on the weight of evidence from the in silico models. And what you can see here as well is those that are not red. So badge, for example, in green is not considered active, so inactive. And this corresponds with what we found looking at the 2 types of NAM-based points of departure. So we were not able to derive an ER pathway which is considered with a lack of activity in silico. So this is just an example of the way that we're looking at consistency and integrating the types of evidence across the different levels of biological organization. If we look specifically now at the NAM-based points of departure after the IVIVE, we can see, and I apologize that it's in a bit different direction in this, but the more potent chemicals are in the bottom left-hand quarter of the graph with decreasing potency as you move up to the top. What we can see here is that the NAM-based points of departure for the general toxicity and pathway-derived PODs, again, are in good agreement or even maybe closer agreement after the IVIVE. And then we want to compare those to the apical PODs, and comparing the NAM-based PODs to the apical PODs, we can see that they are typically lower, indicating that they are protective or more conservative of any of the potential effects that we may anticipate after exposure. And so looking at this together, really what are the conclusions or ultimate outcomes of the application of this IATA? So I think, and I hope, I've clearly demonstrated that this IATA has utility for potency ranking to enable prioritization of substances which may have the greatest concern for toxicity. It's useful for data gap filling, and you can see that again in this figure where there's large spaces of chemicals that have no traditional information at all. And so we're able to fill some of these gaps with NAM-based PODs. And moving forward into risk assessment, this information can be useful in supporting read across. So I think, or hopefully I've shown that through this case study, we've also been able to turn some of the challenges into opportunities, if you will. So through the data collection, we have the opportunity to really influence the design of the experiments through this model selection, exposure selection, and the platforms that we use for evaluation. We were able to explore multiple means of handling and processing data so that we can work towards those best practices. Through the analysis interpretation, we were able to look at various ways of deriving points of departure, including dose response models, again, working towards acceptable universal metrics. We're able to improve and refine the IVIV methods that are being used through different software capabilities and refining model assumptions, and then ultimately converting these in vitro metrics into relevant values that can be applied in our risk assessment context and help us with meaningful outcomes. So in summary, throughout the years that we've been involved in the OECD IATA case studies projects, we've seen IATA implementation rapidly evolve under the CMP from the early use and read across based primarily on structural similarity through to the recent case studies that demonstrate the utility of IATA based on molecular points of departure. And I really want to highlight, as others have, that the research and regulatory partnerships and the international collaborations really have been critical for making progress and for the success that we've seen so far. The case studies provide specific data and hazard characterization that can contribute to the weight of evidence assessment used in regulatory decisions. And really, we want to think about how can we continue to accelerate both the development of the case studies, but also that acceptance, the confidence, and help with the implementation and modernization of our risk assessment approaches. And so to do that, we really need to continue to generate data across large inventories of chemicals. Certainly the development of further AOPs that can cover a broader range of human health-related effects will be important. And we and others have also started to develop computational tools that can help us to integrate all of this information in a more automated way, so that we can kind of in parallel consider NAM data with the traditional effects data to be able to more effectively compile information and screen large inventories of chemicals. And then, of course, touching on the need for the standardization, including the reporting, so that we ensure uniform methodology and interpretation across the different agencies. And the OECD work related to the transcriptomics reporting framework, including the guidance and the reporting template, again, is a great example of that ongoing work. So wrapping this up, again, acknowledging the significant contributors, both from our Risk Assessment Bureau, from our Research Bureau at Health Canada, University of Ottawa, many from the EPA, as well as our collaborations under the APCRA and OECD initiatives. So thank you very much.
Great, thank you so much, Tara. That was great. And thank you for highlighting some of the other OECD activities, particularly that on omics. I think there's been a lot of work recently, and I would encourage you all to visit the OECD website on omics as well. Hopefully from these three presentations, you've seen some of the diverse examples of how IATAs can be applied to cosmetics ingredients, to pesticide ingredients, and in the last case, to data poor chemicals that are used in industry. I mean, very different approaches, but obviously using some of the most innovative methods that are available in toxicology now. That brings us right to time. I'd like to thank very much the three panelists today, not only for their excellent presentations and thoughtful responses in this discussion, but also for their involvement in the program over the duration of the project of the last 9 years. We couldn't have done it without active engagement, not only of submission and case study authors, but also reviewers. So thank you so much. Just to remind everybody, these presentations will be available linked through the website. And I'd like to thank once again everyone who participated, and of course, all those who included questions in the Q&A, and to Hannah Tabe and to Tomoko Aoyagi from the OECD Secretariat, who do so much to support this project. Thank you all for joining us today, and I wish you excellent rest of your day.